Hello and welcome back to our channel, where we delve into crucial medical procedures. Today, we're focusing on arterial line insertion, a vital skill in monitoring blood pressure and sampling arterial blood, especially in acute illnesses or during major surgeries. Let's discuss a clinical scenario that may arise. Imagine you're in the ER when a 55-year-old man arrives in severe respiratory distress. He's a known patient with chronic obstructive pulmonary disease, COPD, and has a history of congestive heart failure. His breathing is labored, and he's unable to speak in full sentences. The initial assessment shows low oxygen saturation and fluctuating blood pressure readings on the monitor. Given his unstable condition and the need for precise blood pressure monitoring, you decide that non-invasive methods are insufficient. This is a classic case where arterial line insertion becomes crucial. The patient requires immediate respiratory support, and you need continuous, accurate blood pressure monitoring to guide his treatment effectively, especially considering the potential administration of vasoactive medications. You prepare for a radial artery cannulation. It's a procedure you've practiced and perfected. With your team ready, you explain the procedure to the patient to gain his consent. As you perform the Allen test to ensure adequate collateral flow, your mind is focused. You know that this arterial line will provide critical data that could be the difference between a rapid recovery and a potential adverse outcome. As you successfully insert the arterial line, you feel a sense of accomplishment. You've not only performed a technical procedure skillfully, but have also contributed significantly to the patient's treatment plan in a high-stakes scenario. But you're not watching this video because you already know how to insert an arterial line. So let's get into the procedure and how it is done. Please note that we are covering insertion into the radial artery, but it can be done in the femoral artery following similar principles, but uses the Seldinger technique. Also, the radial artery is the more common site. Indications. First, let's talk about why and when you'd need this procedure. The indications include continuous blood pressure monitoring in critical situations, serial arterial blood sampling during resuscitation, situations where non-invasive BP monitoring isn't possible, like in severe burns or morbid obesity, continuous infusion of vasoactive inotropes, or if you are using vasopressors, specialized procedures like angiography, embolization, REBOA, or ECMO. Contraindications and what to watch out for. It's important to know when not to perform this procedure. The absolute contraindications include circulatory compromise in the extremity, third-degree burns or Raynaud's syndrome in the extremity, thromboangiitis obliterans, also known as Berger's disease. And don't forget the relative contraindications like recent surgery, local skin infection, abnormal coagulation, or insufficient collateral circulation in the extremity. Materials and medications. Now, let's gather our tools. Antimicrobial solution and swabs, sterile gloves, local anesthetic, like 1 to 2% lidocaine without epinephrine. For radial artery cannulation with an integrated guide wire, you'll need a catheter assembly with the wire. Most hospitals now have standardized sets, as you can see here, and these have all the equipment already placed in it. Take a moment to familiarize yourself with the components of the set, and please take a screenshot or pause the video. Not knowing these various parts of the set will make it more confusing as we proceed. Please note that even though the set you use may not look exactly the same, it will have the same basic components. Radial Artery Cannulation, Integrated Guide Wire Technique. 1. Allen Test. Begin with the Allen test to ensure adequate collateral flow in the selected extremity. 2. Preparation. Immobilize the extremity by dorsiflexing the wrist over a small towel roll and securing the fingers. 3. Locate vessel. Palpate the arterial pulse using your non-dominant hand. 4. Sterilization. Clean the skin with antimicrobial solution. 5. Anesthesia. Inject a local anesthetic to form a small wheal and infiltrate the area superficial to the artery. 6. Assembly check. Ensure the needle cannula assembly functions properly. 7. Prepare the needle cannula assembly and ensure guide wire functionality. 8. Retract the guide wire for clear arterial blood flow visualization. 9. Insertion technique. Hold the assembly like a pen. Needle bevel up. And insert at a 30 degrees angle to the skin. 10. Arterial entry. Advance slowly until arterial blood flow is seen, indicating entry into the lumen. 11. Advancement. Advance the assembly further to ensure catheter entry into the lumen. 12. Catheter insertion. Stabilize the needle and advance the catheter into the artery. Securely position and advance the catheter over the guide wire. 13. Needle removal. Withdraw the needle, guide wire, and feed tube as a unit. 14. Occlusion. Apply pressure to occlude blood flow from the catheter. 15. Attachment. Connect extension tubing, injection cap, and stopcock with transducer to the catheter. 16. Securing the catheter. Secure the catheter with sutures and a self-adhesive sterile dressing. 17. Final steps. Cover with a sterile dressing and secure the tubing. Complications and safety measures. While arterial line insertion is a routine procedure, it's not without risks. Potential complications can include hematoma, infection, thrombosis, and even loss of limb in extreme cases due to ischemia. Always ensure proper aseptic technique and precise anatomical knowledge to minimize these risks. If you are struggling, avoid repeated punctures of the artery or forcing of the guide wire to get access. Rather stop. Ask for help from a colleague, a senior or specialist. Most will be more than willing to assist. Arterial line insertion is a critical skill in various medical settings. Whether you're in an ER, ICU, or an operating room, mastering this procedure can significantly impact patient outcomes. Thank you for tuning in today. If you found this video helpful, please like, share, and subscribe for more medical tutorials. Don't forget to hit the notification bell to stay updated with our latest content. Keep learning and stay safe.